good. You like your new food? She's looking pretty good. You think she looks better? I think her coat looks better. Happy Friday, Baylor College of Medicine and Friends of Baylor. Well, you know, that veterinarian told me I shouldn't be just feeding my dog kibble all the time, so I acquiesced. Lily started demanding better food, and I got her like fresh food, but it's cooked. It's cooked. I shouldn't put an advertisement in, but I think it's farmer's dog. I don't know. But anyway, she's happier. She likes to eat a lot. That's the most important news of the week. Oh, and this is a good one. I have more news from the WHO now that we've dropped out of it. So after many negotiations, years of negotiations, the WHO members decided, hey, we need an agreement on future pandemics. Like, duh, you should have had it before this. Anyway, they haven't passed this yet, but they're proposing that they have access, that all the members provide access and guarantee access to scientific data and pathogen samples and genomic sequences. Of course they do now. I mean, we couldn't get them from China before, so I guess, I don't know. And they say if you share your data and you share in all this, you will have access to any vaccines or therapeutics that are developed as a result. But you know, I think this is like a little too late. Also, interestingly enough, the WHO proposes to retain 10% of the sales from those projects. So I don't know. I don't know. The one good thing that they say is they're going to do a One Health approach, so they're going to start surveilling animals and reservoirs, which we should be doing anyway. I'm not sure that much is accomplished out of this, but they're making a big deal about it. It's all about measles. We're up to 800 cases this year in the United States. It's kind of amazingly equally distributed, under 5 to 19, and 20 years old, all about 30%, 35%. Vast majority, by far the vast majority, are unvaccinated, 96% unvaccinated. There have been 3 deaths, unfortunately, because they're all preventable. If you look at weekly measles case, you can see this big surge this year. And if you look over the years in the past, we're almost approaching 2019, which was one of the highest we've had. But I think we will get there. You know, it's interesting to compare the map of who's been vaccinated versus where these are happening. So the light tan, or orange, whatever that color is, tan or orange, those are under 95%. So if you're under 95%, you can pretty much guarantee that if measles is introduced, there's going to be an outbreak. The blue states are over 95%. And there are 3 new states that are reporting outbreaks: Missouri, Louisiana, and Virginia. And of course, they're 95% vaccinated for kindergartners. So in those 3 states that have reported, Louisiana confirmed an infection in an adult in New Orleans. The person was unvaccinated and likely contracted it during international travel. In Missouri, there was a patient, the patient is a child who was thought to be unvaccinated and probably also exposed to international travel. And in Virginia, it's a child under the age of 4 who traveled internationally. So, the problem is that, if you're not vaccinated and you travel, the rest of the world isn't vaccinated. A lot of measles in the rest of the world. And so if it's not eliminated from this country, you just travel and bring it back into this country, and then you start an outbreak. And that's what's going on. So in Texas, we're the epicenter of the outbreak. 624 cases. It's up from 597 last week when I reported it. And you can see it mostly in this western community, Mennonite community, that was unvaccinated. If you look at the measles outbreak in Texas, by far and away, the vast majority are unvaccinated. So of the 624 cases, 602 were unvaccinated. So that's an efficacy of almost 97%, as we've said along. Now, very interesting, a physician wrote me this past week, really interesting point. My wife had her titers tested, and she had none. So she received a measles vaccination again. So this is not typical, but people have waning immunity, especially since they're not exposed to the virus over time. And so if you get your titers tested, it may be low. And that doesn't necessarily mean you will get it, because you'll have memory T cells that can quickly respond to an exposure to measles. But it does show you don't have active titers. He said, born in 1967, she would have gotten 2 shots, but obviously her immunity waned. Your listeners might want to get their titers tested. I was born in 1963, and our hospital system made us test for MMR and hepatitis B about 10 years ago, and I still had immunity. But as I said, people may have waning immunity as measured by antibody responses, but they still may be resistant to an exposure. But if you're at all concerned, you can always get your antibodies tested and get a booster shot. Meanwhile, in Europe, it's actually much, much worse. There are more cases than they've had in the last 25 years. The WHO reported in Europe the cases have doubled from 23 to 24, reaching 127,000, then the highest number since 1997. So if you're in Europe and there are 127,000 people running around with measles, it doesn't take a lot to be exposed. And as I've said, it's one of the most infectious viruses known to mankind. And so if you're even near somebody who's had measles, you're likely to get it if you're susceptible. And this is linked, of course, this outbreak in Europe is to lack of vaccination coverage. 500,000 children in Europe, 53 countries in Europe and Central Asia have missed their first doses of measles vaccine since 2023. A lot of this is attributed actually to the COVID pandemic because people were so sort of at home and couldn't get to their doctors. A lot of kids missed their early vaccines. And so children under the age of 5 account for 40% of the cases in Europe. It's not just Europe. Canada and Mexico also reported cases. So Canada has reported 730 cases, making this one of the worst seasons that they've had since it was supposedly eliminated from that country in 1998. Same issue, disproportionately affecting communities that are unvaccinated. Mennonite community, Amish communities are particularly susceptible since those communities aren't being routinely vaccinating children. In fact, as I mentioned before, the largest outbreak in Texas is a Mennonite community. Mexico has seen at least 360 cases this year and 1 death. So just a little bit of update on COVID because it wasn't a big season, but there's a lot of stuff going on with regards to COVID. So as you can see, the early indicators, test positivity, emergency room visits are down. Severity indicators, hospitalization and deaths are down. Although this data isn't very good anymore because since May of 2024, the CDC has no longer required people to report COVID hospital admissions, hospital capacity, or occupancy data. So this is only volunteer data. It's probably an underrepresentation. But wastewater is probably the best surveillance tool we have, and you can see nationally it's down a lot. But I told you before I would let you know when the recommendations came out for COVID vaccine. So they're not finalized, but they're beginning to come out. So the CDC is now recommending they be given an annual COVID-19 shots to those who are older or have compromised immune function, rather than the blanket everyone over the age of 6 months. So I think what they're going to come out is if you're over the age of 65 or have risk, you'll probably be required, or suggested, not required, but suggested that you have 2 vaccines per year based on the efficacy of the mRNA vaccine. So again, it's probably over the age of 65. There was a fairly strong support, though, saying that if you want one, you can get one. It's not going to be a restriction. So people who don't fall into the older category will likely be eligible to get one if they want one. So it's interesting. You look back this year, and it wasn't a bad year for COVID, but still it was the 10th leading cause of death among adults in 2023. And from September 23 to August 24, there were roughly 40,000 deaths in the U.S. And I mentioned this last time. We had a bad flu season, but the number of deaths from flu was about the same as the number of deaths from COVID, because COVID is a worse disease. So don't forget to get your vaccines. My guess is when the new vaccine recommendations come out in the fall, and it'll be probably get one in the fall and then another one 6 months later for those over the age of 65, but it'll probably be anybody who wants one can get one as well. So there's another study that showed that COVID vaccine reduced the risk of long COVID. This is a study published in the European Center for Disease Prevention and Control. It looked at people who were vaccinated versus people who were unvaccinated. And the full vaccination reduced the odds of having long COVID conditions by 27%, particularly in children. So one more example why you should get vaccinated. It does help in preventing long COVID. Another interesting study that just came out, researchers are trying to develop a pan-coronavirus vaccine. So one that will, focus on many, many different coronaviruses rather than we're constantly following after the changes in the spike protein. And this is a group of researchers at Scripps. And the thing about it is the receptor binding domain of the spike protein is the thing that mutates all the time. And so we've been making vaccines to the spike protein. And as it mutates, we create new vaccines, and that's why we keep changing it. Sometimes there's a big change, like in Omicron, there were over 30 mutations. Sometimes there are little changes, like what's been going on lately. But there is a part of that protruding protein that is constant, and it's part of the stalk protein. The spike comes off of the stalk. The stalk protein is covered by a bunch of sugars called glycans, and this particular vaccine gets rid of the glycans so that the stalk is exposed, and that's pretty constant. So if this vaccine is effective, then it'll be effective against many, many coronaviruses. Even if the spike is changing, that stalk piece is the same. And so there are phase 1 clinical trials going on right now. We're hoping that works, because what we really do need is a pan-coronavirus vaccine. I want to end today with a bunch of shout-outs. First of all, congratulations to Fasia Conwall, Professor of Medicine, who's been elected to the American Association of Physicians. The AAP is a very big honor. It's extended to outstanding physician scientists. There's a big event where she'll be inducted, and I will be there in black tie tomorrow enjoying that induction ceremony. Also, a shout out to Livia Eberlin, Professor of Surgery, who is a recipient of the 2025 American Society for Mass Spectrometry Bierman Medal for her groundbreaking scientific ideas that have advanced this mass spectrometry pen that can be employed during surgery. It's really exciting science. Also, congratulations to Jessica Gines, Assistant Professor of Anesthesiology in Baylor's Doctor of Nursing Practice program, a nurse anesthesia who received Baylor's Professional Educator Appreciation and Recognition Award. These are student-led awards, so congratulations. It focuses on positive examples of professionalism in teaching. And finally, this week was Administrative Professionals Week. A big shout out to everybody who's an administrator. The most underappreciated people in the world. I couldn't get through the day without our team, and I think the entire College of Medicine would come to a grinding halt without the administrators who run the place. Anyway, congratulations. Thank you for all you do for Baylor College of Medicine, and I can't wait to see you all next week.